name is Rodrigo. I'm the head of artificial intelligence in WebRoster. WebRoster is basically a company that provides a rostering solution, a workforce rostering solution, and we integrate an AI engine behind it so we can automate that process, capturing users' preferences, the care coordinator's preferences, everything into the system. AI is, I think, a big topic today for a series of reasons. Okay, the knowledge itself about AI, it has been, it existed for the past decades. I mean, I'm talking early 70s. Research on AI was being done by them. So right now, the knowledge, the scientific side of it is very mature. What changed in the last few decades, 10, 15 years ago, is how technology is provided and how that impacts the use of AI. So for example, one thing is that AI usually requires heavy computational power. And nowadays, that is very cheap. Anyone can have access to multi-core machines with a ludicrous amount of memory. And you may have it even in your pocket at this moment. So that is very, very highly available at the point. Another very important point is that AI solutions needs to be constantly updated and maintained. So back in the day when you had software coming up out of the shelf, you could find software on the shelf, you didn't have the availability to actually update that software and keep that software improving, growing on. Nowadays, with cloud computing, you have centralized servers that provide very high computational power, and all the developers and researchers around it can keep improving and people can use it immediately. So I think this is basically, this is the main reason why it's now such a big topic, and obviously because the uses of that, and with mobile, etc., everyone has that in their hands right now. Okay, I believe AI can benefit the users, the patients, the workers in several ways, in several ways. We can really go fancy there. If you start thinking about robots performing surgeries, and using multi-spectrum vision, using millimetric accurate precision to perform that surgery. And you might think, okay, that is quite far down the line, but in reality, it isn't that far, because right now we have robots that do that, only that doctors operate these robots and make use of that technology. So in part, that is happening right now. But we don't need to go that sci-fi like. We can go right here. For example, case-based reasoning, decision trees, Bayesian networks. Those are all techniques that have been used on the past 3 decades to help doctors to improve the accuracy of their diagnostics. So these are basically systems where the doctor starts to input the data of the patient, and the system starts to suggesting new questions. And at the end of a process, the system tells the probability that it is a disease, a condition, or another one. Obviously, at the end of the day, it is up to the doctor to see between the lines and see what the patient is doing, the condition of the patient, but the system helps the doctor to see what's not there, what can be easily seen. Another benefit that is heavily employed right now by hospitals, care homes, and anything that has a larger pool of staff is scheduling tools. So for example, like here in WebRoster, but you have for hospitals as well, which is automating a scheduling process so that the rota of the staff, the availability of the staff, and obviously the efficiency of the whole operation is improved. And with a higher efficiency, obviously you end up gaining more, you end up saving costs, which at the end of the day translates to lower costs for the patients. Also, that improves the quality, because obviously you can use AI to humanize the scheduling, to improve continuity of services, for example, or to improve attendance of certain preferences or to give more importance to certain profiles. So everything is really configurable in that sense and can be used to improve the quality for the patients. Another application that you can have that is also very interesting is the scheduling of patients on very busy hospital or hospital wards, especially for diagnostics and exams. So you can have scans or different sorts of exams. So you can use artificial intelligence to better estimate the time of those exams based on the user's profile. And with that, you can use scheduling algorithms to better allocate the times that you have. In essence, making the most use of your equipment and personnel and reducing waiting times for the patients. I believe there are several challenges for a tech company to employ AI solutions. First and foremost is finding the right gap. And what I mean by that is you shouldn't try to find a fancy AI technique and then look for a problem for that. You should do the other way around. You should have a problem and assess if that problem is really solvable by AI solutions and if AI can really bring more substantial content to that problem so that you have something that is actually good for everyone. So yeah, essentially focusing on the problem. Once that the problem is identified and you know what it is about and you know that it can be solved and you make people's lives better by use of AI, then you have the issue with the knowledge, because still AI is a very niche subject. It is an advanced subject of computer science that requires math, statistics, and a multitude of other disciplines. So it is quite complex, and experts and specialists are in high demand at the moment, and well, they are expensive. It's not something easy to do. So this is the second one, finding the right person for the job. Also, we say AI, but actually it branches, and it really branches. You can do a master's or a PhD that is just a tiny piece of the knowledge, and in reality what you want is something on the other side of the branch. So it's finding the right person who possesses the right knowledge to tackle the right problem is definitely a challenge. For that, you have programs, and this is something that we did here in WebRoster. You have programs like the Knowledge Transfer Partnership, which is a funding by the government, and they basically bring a company, a private company, that has a problem that needs innovation to solve, and they find someone in the academia that has the expertise to solve that, and at the end of the day they find an associate that will be the link between these two, will be working in the company, bringing this knowledge from the university. So then in the university you have a series of supervisors that will help with that, and these associates will bridge this knowledge gap, bringing that solution to life. And I think the third point of why is it difficult for tech companies to bring AI solutions is the natural resistance. People tend to have some resistance to the unknown, what they don't understand, and especially when we're talking about automation, because a big branch of AI actually automate processes, just like rostering. Right now, for example, in domiciliary care, you have care coordinators spend a huge amount of their time rostering staff. So when you provide an automated solution that does that, you have some sort of resistance, because it's just like going back in the Industrial Revolution. People think, oh, this might take my job. But the reality couldn't be far removed from that, because the human element in healthcare can never be eliminated. So these are tools to help people to become more and more efficient, not to go and replace them. So yeah, I think these are some of the main challenges that we have. So here in WebRoster, we developed an AI solution to automate rostering, and well, we're working on other solutions for other problems at the moment. But talking about roster specifically, and why is it so difficult? First, a good chunk of the knowledge needed to roster is in people's mind. So care coordinators, they know by heart the people that they are providing care and their staff. So I think the first big challenge that we have is like to provide a concise system where people can input that data and set preferences and be flexible. And this is another big problem, because usually these solutions, they have to be tailored for a problem. But in a company like WebRoster, where we have over 300 customers, well, we have to find a solution that is not over complicated, but flexible enough so it will suit different needs of different companies. So in reality, we end up using machine learning to learn these preferences and advanced heuristic algorithms to do the rostering of the system and to calculate the best possibilities. Obviously, one of the key aspects to solve the problem is giving all the power and control to the user, so they can experiment, change configurations, and try different things in order to succeed, to achieve the results that they desire. And we try to do that by enabling them to choose, well, the most important thing. So they can choose the balance between profit, between mileage, between continuity of service, which is one of the biggest criterion in this sector, which is the same carrier providing the services for the same patient as much as possible. And this is very important for both the private sector and local authorities. So we have to provide them a way so they can balance that. Also, of course, distances is a very important, and not just to calculate mileage, but you have to be sure that a staff member, a care worker, has time to go from visit A to visit B. So that must be very accurate. And so, yeah, it's a very challenging problem. It took us quite good amount of research. We had a partnership, one of these KTPs that I mentioned, with the University of Nottingham. I actually got my PhD degree studying this very problem. So no, it is a problem that we're always improving and trying to improve and move forward with it. But I think we're on the right way. For example, if we have like an elder person in need of care, needs some special care, the system will allow you to input what they actually need and some preference. For example, you may need a female carer, and you need someone that can apply intravenous medication. So in that case, the system allows you to put those preferences there. And on the counterpart, on the staff side, you can put the same information that he or she can do that, and what is their sex, and what are their preferences, what are the qualifications. So at the end of the day, the system will do that match, and it will consider historical data to say, oh, we have like 3 possible care workers that can do that, but care worker A is the one that has been there the most, and the one that has a better relationship with that patient. So we're gonna choose that. But one thing that is very important that the optimizer does that no care coordinator can really do is calculate chain of events. Because the optimizer may choose to sacrifice one of these assignments to improve 3 other ones. And it can calculate billions and billions of combinations in the blink of an eye. So at the end of the day, it can make that judgment call of, okay, care A goes always to patient B every time, but if we had to sacrifice this to put the other care that it's as qualified as, that would free care A to do that other 3 jobs that are much better for the other 3 patients. And at the end of the day, you can improve basically everything. You can improve your continuity of care. You can improve the requirements or the preferences that your patients have. And not to mention the office staff work, because they literally spend hours and hours doing rostering. And the optimizer can do that in a matter of minutes. And that is a huge difference. Another thing that they do that the optimizer can be more efficient is that manually to make themselves more efficient, they typically apply the roster across different days. So Care A will visit that patient every single day. And that makes their lives a lot easier. But that is not the most efficient way, because each day is a different problem. And if you could rearrange a few elements, you could increase, again, continuity of service, preferences, reduce mileage, and more importantly, you can increase your capacity, so you can provide care to more and more people with the same staff and same resources that you currently have. Okay, so I believe that the field of AI right now in healthcare is definitely growing, is definitely increasing, and there's no running from it. AI is all the time getting more and more into our lives, and there's no reason why that shouldn't happen in the healthcare sector. And it is happening. Things are happening all the time. Researches are being done all the time, and it's just growing. So what can I say? I think everyone should really start to embrace it and move forward, because it only brings benefits for everyone. Obviously, I say that as someone that works with that, developed that, but mostly I believe in what I'm saying. I believe that that is the way to go, that will make people's lives better. Well, the future looks bright for AI in healthcare. I thoroughly enjoyed and am enjoying the journey. And if you'd like to know more, please visit www.webroster.co.uk.